Hello, everyone, and welcome to Speedy Global News. I'm Peter.
And I'm Polly. For those just joining us, we're your daily dose of insights on business, technology, health, and inspiring success stories that keep you informed and motivated.
That's right. Whether you're a college student planning your career, a business owner looking for opportunities, or just someone who wants to stay ahead of the curve, we've got you covered.
Today, we're diving into something that's literally saving lives while creating billion-dollar opportunities: AI in healthcare business. Peter, I have to start with this. Imagine walking into a doctor's office where AI has already diagnosed your condition before you even sit down.
That sounds like science fiction, Polly, but here's the crazy part. It's already happening. For example, in Singapore, AI analyzes retinal scans, basically a photo of your eye, and predicts if you'll have a heart attack in the next 5 years. No needles, no blood tests, just an eye exam.
Wait, seriously? Your eyes can predict heart problems?
Absolutely. AI spotted blood vessel changes that even expert heart doctors missed. And that's just one example of how healthcare is shifting from treating illness to preventing it.
That's incredible. But let's start with the basics. Peter, when we say AI in healthcare business, what exactly are we talking about?
Great question. Think of AI in healthcare business as a super smart medical assistant that never gets tired, never forgets anything, and has read every medical journal ever published.
So instead of replacing doctors, it's more like giving them superpowers.
Exactly. Let's break it into 3 types. Diagnostic AI, the detective that finds clues in scans and lab results. Predictive AI, the fortune teller that warns what might go wrong before symptoms show up. And treatment AI, the personal coach that designs a custom plan based on your genetics and lifestyle.
So basically, a detective, a fortune teller, and a personal trainer, all in one.
Perfect. So to recap, AI in healthcare doesn't replace doctors. It gives them superpowers to detect, predict, and treat more effectively.
And here's what's exciting. This isn't just changing medicine, it's creating new business models.
Oh yes, the global AI healthcare market is expected to reach $102 billion by 2028. That's about the size of today's entire video game industry, and it's growing at 44% every year.
That's faster than almost any tech boom we've seen. So let's dive into where AI is making the biggest impact and profit. Now, let's talk about real-world applications. First up, medical imaging. Peter, tell us about that Google breakthrough.
Google's AI can detect diabetic retinopathy, a leading cause of blindness, with 90% accuracy from a smartphone photo. Imagine a $20 device preventing blindness for millions worldwide.
Incredible. And in cancer care?
IBM's Watson analyzes cancer cases and recommends treatments, processing info 1,000 times faster than doctors. That means more patients treated in less time with better accuracy. Next up, drug discovery.
Normally, creating a new drug takes 10 to 15 years and costs $2.6 billion. That's more than building a skyscraper. AI companies like Atomwise cut that to 3 to 5 years and reduce costs by 70%.
During COVID-19, AI even identified existing drugs that could be repurposed in weeks instead of years. And once those drugs are ready, AI makes sure they're used in the best way possible. Welcome to personalized medicine.
Exactly. Companies like 23andMe analyze DNA to design treatment plans for individuals. Success rates jump from 30% with one-size-fits-all medicine to as high as 80 to 90%. Let's talk real-world success. Take Path AI. Their algorithms help doctors diagnose cancer with 85% fewer errors, cutting diagnosis times from days to hours. Hospitals using Path AI can handle 3 times more cases with the same staff.
Another big one is Babylon Health in the UK. Their AI chatbot provides 24/7 medical consultations. Over 2 million patients use it, reducing unnecessary doctor visits by 40%. Cost per consultation? $2 instead of $200. That's a 99% cost reduction. And what about Tempus?
Tempus uses AI to analyze data for cancer treatment. They've raised over $1 billion and are valued at $8 billion, helping over 300,000 patients receive more precise care. But Peter, we need to be honest. It's not all smooth sailing, is it?
You're right. The challenges are big. Data privacy. Medical records are sensitive, and a data breach could follow someone for life. Protecting this data can cost anywhere from $50,000 to $500,000 just for basic compliance. Regulatory approval. The FDA, that's the U.S. Food and Drug Administration, can take 2 to 5 years to approve AI medical. It's like trying to get a pilot's license while the plane is still being built. Liability. If AI makes a mistake, who's responsible? Doctors? Hospitals? The software company? Nobody wants to be the test case. Bias. If AI is trained mostly on data from one group, it may not work well for others. For example, some AI skin cancer tools worked better on light skin than dark skin. Now, listeners are probably wondering, how can I get into this space?
Let's start with college students.
Learn both healthcare and tech. Take courses in biomedical informatics, data science, or healthcare administration. Add free resources like Stanford's machine learning course or Fast.ai. And seek internships at health tech startups.
And for business owners already in healthcare?
Start small. Pick one pain point, like appointment scheduling or record keeping, and try an AI SaaS tool. Some cost as little as $200 a month. Test it before investing big.
Entrepreneurs looking to start an AI healthcare company?
Budget for regulations early, at least $2 to $5 million for FDA approval. Partner with medical professionals, not just engineers. Clinical validation is essential.
Okay, now let's bust a few myths.
Myth 1. AI will replace doctors. Reality, AI handles data. Doctors handle empathy and complex judgment. It's a partnership, not a replacement.
Myth 2. AI is too expensive. In fact, many tools are affordable, like $50 a month for scheduling assistance.
Myth 3. AI makes too many mistakes. In reality, AI often has lower error rates than humans in specific tasks, though it struggles with rare conditions or emotional care.
Regulations sound intimidating. What should businesses know?
3 key areas. HIPAA in the U.S. for protecting patient data, FDA approval for diagnostic or treatment tools, and state medical board rules depending on where you operate. Practical advice: hire a healthcare attorney before launching anything patient-facing. It's a $10,000 to $50,000 investment that saves you lawsuits later.
Let's look ahead. What excites you most, Peter?
Preventive medicine at scale. Imagine AI wearables monitoring your health daily, spotting illness weeks before symptoms, and scheduling preventative care automatically.
Amazing. What else?
AI-powered surgery. Robots performing delicate procedures with superhuman precision, already happening with companies like Intuitive Surgical.
And drug discovery?
Soon, AI will design drugs tailored to your DNA, manufactured on demand. True personalized medicine.
And globally?
AI could democratize healthcare. A smartphone with AI diagnostics could bring world-class healthcare to remote villages.
Before we wrap, Peter, what's your key takeaway?
AI in healthcare isn't just about tech. It's about creating a future where healthcare is predictive instead of reactive, personalized instead of generic, and accessible instead of exclusive. Those who understand this will shape the next decade of medicine.
Love it. And remember, every medical breakthrough started with someone asking, what if we could do this better? Maybe your idea could save lives.
The intersection of AI and healthcare is where technology meets humanity's most fundamental need, health. Whether you're a student, entrepreneur, or business owner, there's never been a better time to get involved.
Start learning, start building, start healing.
That's a wrap for today's episode of Speedy Global News. Thanks for joining us on this deep dive into AI and healthcare business.
Don't forget to subscribe, share this episode, and hit that notification bell so you never miss out.
Tomorrow we'll be back with fresh perspectives to keep you ahead of the curve. Until then, stay curious, stay informed,
And keep innovating for a healthier world. This is Polly.
and Peter signing off. See you tomorrow.